Let's face it, getting and sustaining good health in your 40s and 50s and beyond is not easy. Wouldn't it be great if you could discover the latest cutting procedures and treatments for better optimal health and vibrant living and all in one place? Well, problem solved. This is the NexGen Health and Wellness Podcast, where we talk to local practitioners and doctors from around the country who specialize in anti-aging and regenerative medicine to slow down the wheels of time for their patients. We find out their stories and how they're making a difference. Welcome to the NexGen Health and Wellness Podcast. Now, your host, Steve Champagne.
Hello, everybody. Welcome to the NexGen Health and Wellness Podcast. Today, I have a very special guest. I got Dr. Carson Bauder of New You Cosmetic Weight Loss Center in Ormond Beach, Florida. Welcome to the show, Dr. Carson. How are you?
I'm well. Thank you, Steve. I'm joining you from the comforts of my own home this morning.
Glad you could do that, huh? You're a busy fellow. So today I'll be chatting with Dr. Carson about weight loss and his medical weight loss program that he has. And also when that doesn't work, we'll be talking about some procedures that are available to you when you have some stubborn fat that you're looking to get rid of during these older years. So without further ado, let's get into the show today. Doctor, before we got on the show, I want to know a little bit more about your backstory and how you actually got into medicine, because you are an MD. You still practice medicine, and tell me a little bit why you got into medicine in the first place.
Yeah, so I got into medicine. I was actually planning on going into education. I was going to maybe teach science and coach some sports, football, wrestling, that kind of thing. I took anatomy and physiology my first year of undergrad, and the human body was so amazing, I decided to switch my major and ended up going into medicine.
Okay. So you've been practicing medicine now for how long?
A little over 15 years.
All right. So you launched the med spa, you opened up a med spa, a New You Cosmetic. What made you decide to get into medical aesthetics?
So that happened during medical school. So probably about 19 years ago, during my first year of medical school, I was able to work with a plastic surgeon who was amazing. He did everything. He used to be a dentist. And then he went into plastic surgery after that. So we would do reconstructive work on Shriner's patients. We do cleft palate in kids. We did tons of cosmetic procedures. We even did SRS, or sexual reassignment surgery, back in 2003 before it was even in vogue. I really enjoyed the aesthetic field in general. I wasn't too keen on the OR, just bending over the whole time. It's very cold in there, but I did love all the less invasive procedures.
Okay. All right. So that's your backstory. How long have you had your med spa?
About the same time, 15 years.
All right. So you have a medical weight loss program. Tell me a little bit about that. What is it?
Yeah, so we have a physician-supervised medical weight loss program with a proprietary diet that includes foods that patients can buy at the store with portion sizes that are allotted per mealtime. In addition, we have a nutritionist that meets with the patient to talk about meal plans, portions, and strategies. We also offer an appetite suppressant to assist with weight loss.
Okay. So, the big one out there is Weight Watchers. How does that different?
Yeah. So in addition to our weekly visits that we have, we don't have prepackaged shakes or meals. We actually allow the patient to go out and pick out their own foods from the grocery store. So that way, when they come off of our weight loss plan, they already have a structure of what they can eat when they go to the grocery store themselves, instead of coming off of Weight Watchers and now they're in a whole new arena with regular foods and then they gain all their weight back.
Okay. Common question you probably get is like, how long do I need to be on this program?
Yeah, and that depends on the patient and how much weight they want to lose. Some patients want to get fit for a wedding; they're in for a couple of weeks, and then some patients want to lose, 60 to 80 pounds, and they're with us for several weeks or a couple months.
So this will be the last question I have for you on your weight loss program. Generally, what is the typical results that your average patient is seeing? How much weight are they typically losing?
I would say typical weight loss is around 2 to 6 pounds a week.
Okay, wow, that's pretty aggressive.
Yeah.
Okay. All right. Let's move on and let's talk about when weight loss programs are not getting rid of that stubborn fat that we all tend to collect in our older years. And you got a couple of procedures we're going to go over today. The first one is TrueSculpt. First of all, how does that procedure work, and what is it?
Yeah, so TrueSculpt is an FDA-approved kind of fat removal or body contouring procedure that works with radio frequency energy, which is a very safe energy that's delivered to a pocket of fat tissue. In addition to kind of killing the fat as your body removes it, it will tighten the skin as well. So this is excellent for patients that are looking to have a non-invasive, non-surgical procedure and for stubborn areas of fat.
Okay. There's another service like this out or procedure out there or treatment out there called Cool Sculpt. How does True Sculpting different from Cool Sculpt?
Yeah, so Cool Sculpt was out for a long time and had really good advertising from Allergan. Cool Sculpt uses cryotherapy to freeze the tissue, freeze the fat cell, and kill it, where we use heat to heat up the tissue and kill it. The advantage of True Sculpt is, one, you're going to get skin tightening. Whereas with Cool Sculpt, you may lose the same amount of fat, but now you have loose hanging skin. I've had patients come in that have had a Cool Sculpt at another facility, come to our facility, very unhappy because now they have loose hanging skin. It looked better before the procedure. In addition, Cool Sculpting has a lot more side effects. You can get temporary to permanent nerve damage. You can get bruising. You can get fat hypertrophy, where the fat actually comes back more than it was before.
Okay. I'm sure most folks want to know, what is the typical downtime associated with a True Sculpting treatment?
Yeah, so at True Sculpting, each area that we treat, which is about this size, is 15 minutes. On average, we treat 4 areas per patient visit. Your downtime is really nothing. You may be a little bit red or warm in the area that we treated, but otherwise you can go to the gym that same day. You can go out and do anything you like.
All right. This is the last question I have for True Sculpting. How long does this treatment last?
So this is permanent. Once it removes that fat cell is gone.
Okay. Explain that a little bit more for me.
So the way fat cells work is they usually get larger and smaller. They increase in size or decrease in size, depending if we're eating more or dieting. What this procedure does is it heats that top layer of fat and kills up to 25% of those fat cells. And those cells are gone forever.
All right. That seems like that would be a really cool procedure. I wouldn't mind getting done in a few areas myself.
I've had it done myself, actually.
Okay, good. I'm glad to know that. All right. So we were talking before the show about a new service that you just brought on. It's called Youthful laser liposuction. Why don't we talk a little bit about that? What is that all about? What is it?
Yeah, Youthful is liposuction. It's an in-office liposuction where we use tumescent, which is a numbing solution, to numb the area that we're going to treat. It also has the option of fat grafting. So if we're treating an abdomen, we can liposuction the abdomen or flanks or thighs or other areas, and we can save that fat, clean that fat, and inject it into other areas. Most popular areas would be some facial areas like cheeks, tear troughs, breasts, and now those BBLs, the Brazilian butt lifts, are very popular as well. So we can inject in all those areas.
So that kind of leads me to, how does this differ from, say, standard liposuction?
So it's essentially the same. The difference is we're not putting you out, right? So a lot of patients, especially patients as they get a little bit older, 40s and above, don't want to be put under. They fear being put under. So this is in office.
Okay. Like True Sculpt, what's the downtime associated with a procedure like this?
So the downtime for this, after the procedure, the tumescent comes out over the next day or two, and that's a little bit of like fluid draining. And then we have you in compression garments for a couple weeks or up to several weeks after that.
Okay. The last question I'm going to have on this is, how long does the treatment last?
So again, this is permanent. Once we remove the fat cell, it's out of your body. We do recommend getting some massages afterwards, lymphatic massage, to help to continue to remove that fat most expeditiously.
Okay. So when someone's looking to do some body contouring, they basically have a couple choices with you. They have True Sculpting and they have Youthful. When it comes to making a decision and a recommendation to your patient, what kind of weighs you one way or the other to help them make a informed buyer's decision?
Yeah. So, a lot of patients, it just depends on how invasive they want to get and then
Okay.
the area, right? So you can have a person who's relatively fit, who has just a stubborn midsection or stubborn
Mhm.
love handles.
Mhm.
Despite dieting and exercise, those won't go away. They are looking for something less invasive. Then we'd go more
Mhm.
towards the True Sculpt. If a patient's looking to lose a significant amount, then we'd probably go towards the liposuction with the
Okay.
Beautiful. And you
Okay.
can use both of these in conjunction with our weight loss program as well.
Okay. You have so you would probably recommend folks probably start off with your weight loss program as they're getting into that, and you have a special offer for them.
Yes.
I'm assuming we were talking.
Yeah. So, some patients will come in and they'll actually go right to a True Sculpt to jumpstart their weight loss. But in
Yep.
general, yeah, losing weight, depending on the patient's body habitus, is a good way to go. Right now, we have an offer for our initial visit, which includes the meeting with our nutritionist, physician meeting, EKG, vitals, and medication for $49.
Oh, that sounds like it's a really, really good offer for them. Well, folks, we're going to start wrapping up the show here. We're coming up on about 12 minutes. Dr. Carson, thanks for being on the show. If they want to find out more about you, where can they go on the internet? What's your website address?
Yeah, so we're Florida.com.
Okay, and your phone number?
That's 386-FITT, which is FIT, or 386-872-3488.
Well, there you have it, folks. Dr. Carson, thanks for being on the show. Until the next time, make it a happy and healthy day. Take care.
Thanks
Bye.
for having me.
Bye.
You have been listening to the NexGen Health and Wellness Podcast. If you specialize in regenerative medicine or anti-aging and would like to be a guest on the show, please visit nextgenpodcast.com for more information.